Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning to the podcast. Like having you here. It's always fun. Today, I want to get into testosterone replacement therapy in women just a little bit more. And then I think I'll probably do one more on this where I'm going to answer questions because there's so many questions were posted. If you remember, was supposed to be like a 3 or 4 episode arc we were going to do. We kind of went down a little bit of a rabbit hole in there. So I think we're at like 5. What are we, Evelyn? We're at 4 or 5 episodes now? This is a long one. I'll conclude it soon because I want to get on to other stuff too. There's other stuff I want to talk with you about. I've been thinking about a couple of key ones. Inflammatory stuff, which I think is important to talk about. I wanted to make a series on, I had some menopausal weight gain, why, how to lab around and understand it, because weight gain has always been such a frustrating thing. So I have a whole series on I wanted to do on that. There's a few others out there I got, I'm percolating on. So I want to get to them. The only way to get to them is to conclude this. So I'm going to conclude it. I'm going to conclude it soon, I promise. So testosterone replacement therapy in women is so controversial. I remember when I first started practicing medicine and it was not done. And no one was doing it. I remember it was such a heretical, crazy thing to do. It was so nervous. And now it's like so many doctors do it. And so it's nice to see it being adopted. But part of it I get nervous about is like all the things that I went through learning how to use testosterone safely in women. It's tricky. I had to teach myself. You have to self-educate. And that takes so much drive and determination on the part of a clinician to just constantly read research. Because, on one hand, you have this woman in front of you that you really want to be helpful and you really want to do your best work for her. And then on the other hand, you're like, how do I do this safely? How do I manage this? How do I provide this for her? Because I know it's going to be a benefit. She reports benefit. Labs are showing benefit. How do I do this in a way that I can sustain it safely? So, years of work went into understanding this stuff. And so when I come at it now and I see, a lot of, posts online, I see patients in my clinic who are being given, replacement therapy at, just insane dosing or just not really being well labbed or cared about. It gets me, nervous and it stresses me out. Like yesterday, I had a man come in and, no joke, his doctor had put him on testosterone replacement therapy and did not run labs. And the man's testosterone was, I think it was almost 4 times the range for a man. And because it was so much testosterone in him, it was creating so much estrogen. So his estrogen was wicked high. And also his estradiol was high. And he was like, I don't feel good. Of course, he's not meant to have that much. And he didn't know anything better because he trusts the doctor. There's been so much abuse in medicine to women. I've said it before, and I'm not going to dive too deep into it today because it's a fact. Let's all just accept this as truth. The women have not been well managed, well cared about, well thought of, well treated. Okay. And you know it as a woman, and you've given trust to this institution only to have that trust broken frequently. And you still go back to it. And then sooner or later, though, you're going to point where you're like, I'm sick of this. And you're like, I don't want anything to do with it. And we're seeing this now. I see this now. And I see it out there in the medical landscape that I'm in my area of Arizona. I see it online. It's obvious. There's a huge tilt away from the standard medical model. It's out there. It's just moving. It's obvious that's moving in that direction. The thing is like when someone has betrayed you that much, it's easy to just say everything that they said and did was wrong and bad. And it's easy to say whatever's the opposite of what they did is going to be better. And that's how the mind works a lot of times. We tend to go into this binary approach. What I want you to know is there are people on the other end of the binary equation that are going to tell you things like, yeah, everything they say is wrong and you don't need, lab work. You see, my agenda is starting to slip in, isn't it? It's I'm not subtle. I'm not subtle. There's nothing hidden with me, but it's true. You'll have people out there who are going to pander to your anger, who are going to stoke the worst part, and they're going to pull you in this direction. You don't need this, whatever they said and did, because the betrayal of your trust is truly wrong. But that doesn't mean all the things they were talking about were wrong. It's just the way it was used was wrong. And you were not given correct care. That doesn't mean science is bad. That doesn't mean the medications are all bad. Some are bad, true. But I'm trying to make a nuanced point, and it matters to me because I care. I want to do a good job. We always run the risk that when we've been betrayed so much that we throw out the good with the bad. My podcast is an attempt to salvage that, to not let the baby get thrown out with the water, so to speak. I see that on the other end, the people who are on the other end of the equation who are pulling and saying, it's all bad, it's all evil, they're the ones, there's a financial hook on their end. And that's how I hope to distinguish myself from them, is to show you that I don't have a financial hook in here for you at all. None. If you go to any of those other influencing podcast types, you'll see that they sell you stuff, supplements, and sooner or later they push a protocol on you. All of them do. I will never do that. Because what I want out of this is not to sell you something. I want your trust. I want to earn your trust. And then through that earning your trust, I like to see a revolution in medicine and medical care for you that's lasting and meaningful. One that you control because you understand what it is that you need. You're able to articulate it in a meaningful way to your providers. That is my agenda. That is my goal. Testosterone replacement therapy. Before I get into further with the testosterone replacement therapy, if you like what I'm doing here, subscribe. If this is a good episode, press like. And if you think it's going to help one of your friends, share it. So with that said, let's get into the material of testosterone and how it plays an effective part of your, a meaningful part in your healthcare. Let me say this. How I really got into testosterone was because of its benefit to prevent breast cancer and its benefit towards breast health. Because testosterone has that benefit. Testosterone is largely anti-proliferative, and one of its major metabolites, dihydrotestosterone, largely anti-proliferative. Study after study after study shows the benefit of testosterone in preventing breast cancer. So I'd love that. And even in some cases causing apoptosis in these cells, or convincing those cells that are pro-cancer to kill themselves, to basically die, cell death. And that's known. And I'll have citations in here as well for those, because I think that's important that you know where I get my data from. By the way, guys, if I ever make a statement on this episode or any episode ever where you're like, where did he come up with that? You deserve me to cite all my work. Okay? So if you ever like, where'd you get that? I'm happy to share it with you. I want you to read it too. I do. I think the more people who read the original source material, the more you're going to have a good conversation together. And then you'll say, hey, Brendan, I read that. And, I think maybe it should be this instead. Or hey, Brendan, I read that. That's really cool. I read this also. And we start having these conversations and we build knowledge together. Just because I'm the physician doesn't make you less intelligent or less valid a member of the I don't know what to call what we are. Movement, something. Yeah. A lot of lay people discover beautiful things. A lot of lay people come up with brilliant things. Just because you haven't been classically trained in research and science and studies and articles doesn't mean you're not capable of understanding this material. So, testosterone replacement therapy for breast cancer, awesome stuff. Awesome stuff. And the literature again is abound with the discussions on why it's beneficial. And I wanted to cite one study that I thought was fascinating that kind of brought me into this conversation, why I wanted to bring it up. When you give a woman testosterone replacement therapy, you have to know what it's going to do in their body. You have to know what it's going to convert into and how it's going to move through their body. Still, many studies show that when you give a woman testosterone replacement therapy, that they have the lowest incidence of breast cancer. Now, there's one study I want to bring out, and that's the testosterone therapy and breast cancer incidence study. And that was a 9-year retrospective study, and investigated 2,400 women, around 2,377 women. And it was pre and postmenopausal, and they were given testosterone, and then the postmenopausal were given testosterone with estradiol, and they were followed for 9 years and watched for incidence of breast cancer. And what we found there was fascinating. We know that the study found that an invasive breast cancer incidence was at 144 cases per 100,000 person years. That's 144 cases per 100,000 patient years. What's important about that is it's substantially less than the normal range for a person who's never received hormone replacement therapy. 144, the rate is lower than the age-specific surveillance epidemiology and results. They had an incidence of 223 per 100,000. We also had the placebo arm of the Women's Health Initiative, and that had 330 cases per 100,000. So using testosterone is up to half. It's a 50% reduction in many cases of incidence of breast cancer. That's big. That's a lot of women they studied. That's for a long period of time. That's just one study I just pulled up. So using testosterone in women pre and post menopause can reduce between 30 and 50% their incidence of breast cancer. That's amazing. That's something we should all be happy about. This is all something we should be considering adopting in our clinics. We should be doing this. We should all be doing this now. Think about it. Think about this. Picture me here. All right, if I was gonna be that guy, like, hey, everybody, I'm selling my new supplement. Imagine someone went out there and showed you with research that they can reduce your risk for breast cancer by 35 to 50%. Would you buy that product? Yeah, you would. So would I. We all would. And that's what testosterone has done. It is an amazing tool and is a useful tool. So why don't we all just grab it and use it and fire it up? Why? The thing is, though, when you give a woman testosterone, it's not just all great, like taking vitamin C, or taking vitamin B12. It's not benign. The study I just cited, giving you testosterone replacement therapy, how it reduces that risk, that's awesome. We should all be using it. But we shouldn't just use it blindly. Because there's another study I'm gonna discuss, another thing I want to bring into here that I think is very important for you to understand. There is a role that testosterone plays in breast cancer in a negative sense. See, this is the thing about the human body. It's not a straight line. It's a symphony. It's a marriage of so many different things being brought together. And to try and be binary, being this is good, this is bad, it's what was done to you with the Women's Health Initiative when they said estrogen is bad. And it was so much more nuanced than that and not correct. Estrogen's not bad. It's wonderful. It's a beautiful part of you. Synthetic estrogen derived from horse urine that's not even human is definitely bad for you. synthetic progesterone that's made in a lab that looks more like plastic in an electron microscope than that it looks like progesterone is bad. Bioidentical estrogen is good, but too much is not good. If it's too much, it could be pro-proliferative. That's not good. This is nuanced stuff. I want you to know that using testosterone replacement therapy can be so helpful preventing breast cancer. It's just it needs to be done correctly. Because when you give a woman testosterone, you have to understand it also converts into other metabolites that could be of risk. When you give a woman testosterone, what happens? It's going to get converted to dihydrotestosterone. Okay, that's good. It should do that. Dihydrotestosterone is a metabolite that is anti-breast cancer. Absolutely awesome. Dihydrotestosterone plays a role in libido, sexual function, plays a role with healthy muscle mass. Dihydrotestosterone is not a bad thing. It's a good thing. Too much dihydrotestosterone is not good for women. That can create oily skin and create more body hair, clitoromegaly, deepening of the voice. It's going to cause someone to have the thinning of the hair. It's just not good. Too much dihydro. You need to be in the sweet spot for it to be good. Okay. What else does testosterone do? Testosterone, when it's in your body, it can be aromatized into estradiol. Now, when we do testosterone replacement therapy, if I'm doing it as I normally do, the doses that I would normally do, I'm always monitoring that aromatization to estradiol and the conversion to dihydrotestosterone. Still, the aromatization to estradiol needs to be thought of. When women have things like congenital adrenal hyperplasia or polycystic ovarian, any one of those androgen secreting tumors, anything that would create hyper levels, super physiological levels of testosterone in your body, there's always the chance of the conversion to estradiol and that pro-growth component of estradiol stimulating your breast cells, and the estrogen being too high and you're not having enough dihydrotestosterone and testosterone to inhibit that estrogen. So this is when giving women testosterone needs to be thought out, because if they're hyper-aromatizing to estradiol, as a physician, you need to be aware of that, because that's a proliferative thing. Doing lab work for you is meant to be guardrails to keep you safe and to be accountable to you. On my part as a physician, to be accountable to you that I'm doing something safe and showing you my work. Otherwise, I'm just saying, trust me. I know what I'm doing. And that sounds eerily similar to what was told to you all those years ago when you were gaslit, lied to, medically abused. Trust me, it's all in your head. Trust me, take this pill. Trust me, you need this surgery. Trust me. Giving you lab work and sitting in front of you, explaining the lab work in a meaningful way, being accountable and saying, this is the research, this is the material, this is the source material, this is why I think the way I think. That's accountability that you deserve. That's me showing my work. Me just, blind firing hormones into you saying, oh yeah, we don't give you labs, you don't need labs. That's what they used to do over there on that end. That never helped you. That's not good. That's not good at all. That's actually, that benefits the person who's prescribing you a medication without lab work, because it takes so little work to write you a prescription and not do lab work. It is such an easy thing to do. I've said it before, it's true. Any monkey can prescribe hormone replacement therapy without lab work. That is not real intellectually challenging work. It's just dumb, but it's so damn dangerous. Using lab work around testosterone replacement therapy is the key to proving its effectiveness and safety for you. Using lab work for you is never meant to be the obstacle to prevent you from having care. It's always been the ability to show you I did what I told you I'd do, and I'm keeping it safe. By the way, how do you feel? Is it working? And if it isn't, These are the areas where I have wiggle room. Let's adjust it and move it over here and see if it had the benefit. And if none of that worked, what else do I need to think about as your physician? Does testosterone cure breast cancer? No. Will it 100% prevent breast cancer? No. Will it reduce risks? Studies prove that is true. Studies prove it. In my medical opinion, along with those studies, yes, I stand by that. I do stand by that. It reduces risks. I do stand by the research on that, and I support that. I believe in that. That doesn't mean I'm not open-minded, you know, but still the studies stand on this. Getting this type of care, does this mean you don't have to monitor your breast health? No, it means you always should. It shouldn't be, breast exams should be an independent thing of anything else. You should always do this. This is an important part of self-care. So regular breast exams, absolutely. So doing hormone replacement therapy, does that mean you need to stop that? No, you still should continue normal, healthy breast care. That's important. Does delivery method make a difference with testosterone in women? I've mentioned this in this whole series over and over again, why I pick the routes I pick. It does make a difference. And it's important for your doctor to acknowledge the way they give it to you and how that method of delivery has risk and how they're going to help manage that risk and keep you safe. Because that's what your doctor's job is. So I hope this helped. I hope this series on testosterone was meaningful. I hope that I communicated this in a clear way that you found beneficial. To the degree I did, all right, I'm doing a good job. To the degree I'm not, let me know. Let me know. I'm here. Like I said, the next episode, I'm going to do a few Q&As in there for you, the questions from the series. I'm going to pick a bunch out that were really important, and I really need to respond to a bunch of them. You guys, I love you guys so much. I love you. The way you talk to one another, your communication there's so much care that goes in there. And I just am so thankful to be a part of this with you. And I'm so thankful you welcome me into this space with you. So yeah, thank you. Again, I will see you at the next episode, and take care.